What would you do if someone told you that you couldn't have coffee or caffeine at all for about months? Laugh? Murder? Makes sense, right? Caffeine is the most widely consumed psychoactive drug in the entire world. It's no wonder that a common question I get after bariatric surgery is, when can I have coffee again? After bariatric surgery, it's extremely important to stay hydrated. Because of the chemical and hormonal changes that occur, you sometimes no longer feel hungry or thirsty. Dehydration can lead to nausea, decreased healing, and even kidney damage. It's the #1 reason that people come back to the hospital after bariatric surgery. Caffeine is a diuretic, meaning it can make you pee more than needed and cause dehydration. Because of this, many surgeons recommend avoiding caffeine for the first 30 days or even longer after surgery. But coffee is also pretty acidic, so it can lead to stomach irritation during the crucial time of healing. This can be mitigated by taking an acid-reducing medication during the first 2 weeks after surgery, but some surgeons still don't like it. If other surgeons make you abstain from caffeine for a month, why is it that I allow my patients to have their coffee in the immediate post-op weeks? 75% of the people that I do surgery on are somewhat chemically addicted to coffee, including myself. Withdrawal symptoms from caffeine peak about 24 to 48 hours after stopping and can last up to 10 days. These things can be like headache, fatigue, irritability, muscle pain and stiffness, nausea, vomiting, or depressed mood. So it's really a risk assessment on balancing staying hydrated versus experiencing caffeine withdrawal. So if you do decide to drink caffeine post-op, try remembering a few things. It doesn't count towards your fluid goals and can even negate some of the fluid you drink, so you have to be able to compensate for that. If you're struggling to get in even like 8 ounces a day, those ounces should not be coffee. Next, consider the amount of sugar in whatever coffee you're drinking. Espresso and black coffee are very different from an iced mocha latte. Limit yourself to 1 cup of a caffeinated beverage per day if you can, or whatever minimum you can do to avoid withdrawal. And finally, track your water intakes to make sure you're reaching your daily hydration goals. Remember, no matter what I say, you should always follow the instructions of your personal surgeon. Every practice is different and every surgeon has their own reasons for their recommendations. So if you had bariatric surgery, when did you start having caffeine post-op? Did your coffee order change after surgery? And what tips can you share about managing the post-op caffeine cravings?